home real time. Things are gonna happen, somebody's gonna forget to clock out, their phone's gonna die, whatever. If that happens and your caregiver comes back and says, oh my gosh, I left at 5 o'clock last night, I didn't clock out. You can fix that. You can go in the system and you can enter it and say, this is 5 o'clock clock out, but then, as Renee mentioned, it has to say, the reason this was touched, the reason this was updated is because our caregiver forgot to clock out. And we also highly suggest that you reach out to the client before you make that entry and say, hey, Susie said she left at 5 last night and she forgot to clock out. Was she there till 5? Just so that you can have that documentation in your record, because you are gonna have some caregivers who habitually forget to clock out. Do you wanna finish me?
No.
You're like, but, and that's a lot of work. But knowing that that's a lot of work, that's your incentive to get your caregivers to do what they're supposed to do. Because if you're always having to clock somebody in and out because they keep forgetting, you need to be like, what is wrong with you? This is part of your job. Clock in and out, it's a job, do it. So, and I know that sounds really harsh and it makes it sound very simplistic.
That's what I say.
Yes, but it's like, there is no, every once in a while, sure, I might wear mismatched shoes every once in a while, but I don't do it every day. And if I did, my boss wouldn't know what was wrong. So it's just getting people to be responsible and accountable for their own actions and using this as a tool to do it. You look like you wanted to say something. Yeah.
No, I'm
You were
agreeing.
agreeing with me?
Yeah.
Oh.
Because if you all aren't asking those questions, I'm gonna get a case on my desk and I'm gonna have to go ask those questions of the client. Why when did she leave? Are you the one clocking in and out?
And that's gonna reflect poorly on you if you haven't done your due diligence and asked about it. So it just makes sense. If somebody doesn't do what they're supposed to do, you guys need to be all over that.
So another question.
Yes,
This question I'll just ask till.
No, you can ask until 3:15.
Okay, good.
And then I shut down.
Okay, well, great, well then I better talk fast. So my other question. Oh, I have plenty of time. Ask her.
Good.
Hey, I love her question.
I do too, actually. She knows it.
I know, but I always know the answer, but I ask for you.
I know because you're me. Go ahead.
I know. So so currently, our EVV regulations, are not written to everything that's among the specs of SAM data and the whole aggregator. So can you let us know where you're at on the revised EVV regulations and those review previous?
Are you talking specifically about the Family Care Safety Registry or some other?
Oh, all those fun pieces and the ethics code and all those lovely things.
So, so we have drafted the regulation, it has been out for comment, it is currently sitting with our legal staff. I don't know when it's gonna be implemented, but, I mean, that's all I got, I can't give you a date. I would like to say in the near future. Is there a certain part of it that you're worried about, or are you just being curious? And I ask that because I truly want to know.
It's been a while since it's been forever ago. But, no, I'm just curious because that to me is when you can,
That's when we
when
grow
you
our
have the
teeth, right?
statutory authority to hold us more accountable.
But here's the
so,
thing,
yeah.
you're right. So our current regulation doesn't say you have to use the Family Care Safety Registry number to identify your caregivers. That's true. However, in order to successfully submit visit data to SAM data, you have to have that information. So whether you're in compliance with the regs or not, if you're not doing that, you can't be in compliance with EVV. So you're right, it gives us some more teeth to hold people accountable, but just by the nature of what we're trying to see in the system and what the requirements are to get that data in order to be compliant, we're gonna have to do this stuff. Did that make sense? Was that just a big?
Required by implication.
There you go, what he said.
To meet the requirements, it applies to our steps you have to take to.
No, I agree. I do recall that there wasn't a threshold percentage-wise in those draft regulations. It's gonna be matching slowly, it's gonna lag.
And there probably won't be.
So then how do you hold us to that 100%? Well, you have usually.
Oh my God, they're huge!
I'm personally insulted by that. Do you have any insight into how we can hold them accountable for 100% compliance if it doesn't actually state it in the
That's
regulation?
gonna be a Dale question.
Okay, that's a Dale Carr
It's a
question.
Dale
Okay, well, I
question.
will go ask that.
We'll talk to Dale about it. I mean, those are all conversations that are still, I know, but I appreciate you bringing things like that up. I seriously now wanna do that. Because we do, I mean,
Yeah, it's a
right?
good question.
I'm spitting, I have huge teeth. I appreciate you putting that back on the radar though, because we have gotten really caught up in looking at the data that's in there and having some fun and doing some analysis. And maybe some of those pieces I need to light a fire under again, so, thank you for the motivation.
Oh, you're welcome.
Yes.
Any challenges come with the upcoming requirement for home health, the aides utilizing, will there be any changes, or will we be held to these as well, same standards?
So, yeah, it's in here somewhere, there's not hardly anything about it. So, we really are just now kind of starting, I'm behind schedule on our home health care implementation, because it took a little bit longer to get where we needed to be with this. I think everybody in this room probably can attest to. We're a little behind. But we're starting to put together our requirements and what we want that to look like. What I can tell you about home health care services is that I do anticipate that we will be requiring EVV for pretty much everything that's included in there, including nurse visits. So, planting that seed in your mind, yeah, very likely that we will be including nurse visits. If we do that for home health care, very likely we're gonna decide to do that for other services as well. I'm not saying that's 100%, I'm saying that's something to have in your mind. Yeah. So, at this time, I do not believe that EVV is going to be required for hospice services. It will just be solely the home health piece.
So when you say home health, what do you mean, like, we do skilled nursing, because that's all Medicaid will pay us for, you know, we can't.
So, and that's tricky, because most of the home health care services really are Medicare, right?
Right.
Correct.
So we are going to be looking, as far as I know, I will just be brutally honest. I'm having a really hard time getting CMS to communicate with me about how
Well,
this.
they're telling us by January 1.
Yeah, that's
Yeah.
true. That is true, that's our goal, that's our goal.
Yeah.
However, I will say, if I, as the state EVV lead, do not have the system ready by January 1, I'm gonna be the one that gets in trouble, not you.
Well, but I guess what I wanna know, will we be going through the same thing, because my vendor keeps asking me, what are you guys using, what does the state of Missouri use, what should we be building?
Right,
To
so
do, to
we,
meet the state.
at this time, our expectation is we're only going to be talking about those home health services that are funded through Medicaid, which, Carol, correct me if I'm wrong, that's a pretty limited, it's not big.
No.
So, what?
Get a rate increase. Might go up a little.
Yeah.
bit.
So,
You're actually getting paid for your work now?
No,
Almost.
it doesn't even
I know,
come close
it's-
to covering it.
I'm on your team with that, yes,
but they're out
it
there,
makes
I mean,
me
the
sad.
Medicaid patients, you know.
Right, so there are, it's a pretty small population, but those are the ones we're gonna be looking at. And so any of the services that those Medicaid patients are getting through home health, it will be a similar type system. Where
But I shouldn't go now and go into this training. If
No,
all I
so what will
do is
happen
skill.
is, okay, I'm tracking you
Okay.
now.
All I do is skill, I don't do
You're
any
here,
of
my
this.
brain is way under. Okay, so whenever it gets to be time, we will be sending out information. We'll have some kind of town hall type meetings where we tell everybody this is what we're gonna do. And Renee, I know you were gonna talk about home health, but here we go. We will tell everybody, this is our plan, and then we will reopen that registration process that I talked about earlier. So even if you're doing, personal care, in-home personal care now, unless there's a significant change in the path, whenever we go to implement the home health care services, you will still go in and register your vendor with your home health agency and start over again, because the training's gonna be a little bit different, it'll be tweaked a little bit, so,
Right.
it'll be a restart.
Under the Medicaid 58.
She probably knows that more than I do, I don't know.
I don't know, but what I was gonna mention though is what you need to be thinking about now or talking to your, EMRs or whatever
Yeah.
about is the FCSR identifier numbers. Because that's something that all the personal care providers had to do was go and manually enter into their system, dig through pages
It was
files.
great fun.
Yeah.
Okay, so I guess I'm
You're
lost, I don't
welcome.
know what you're talking
So,
about.
the EVV requirement is you have to identify the caregiver. So you have to have a caregiver identifier. Most EVV systems did that, they gave them a number, or some used the last four of their social, I don't know, everybody probably did something different. Right. The state says, or I guess, the state.
You pointed at me.
The
The state, right there.
And then when the aggregator and everything got set up, they couldn't take all the different data collections of the caregiver identifier and transport that or get it to look right in the aggregator. So they said, everybody has to do the exact same caregiver identifier. And what they came up with was their FCSR number.
Right.
So that's something probably home health agencies need to start looking at. Because if
Definitely
you
something, I
have
agree, thank
you know,
you.
maybe the home health agencies don't have as many employees as, you know, the
But all
personal
our
care.
employees will have to be
Any of them
put in.
that you would require EVV for,
Okay.
on your Medicaid, you know, I'm assuming your nurses do Medicare and Medicaid, that,
Correct,
you
they do
know.
both, yeah, and it's only really nursing because Medicaid doesn't pay for any other skill.
Exactly.
Except for nursing.
And it's, we still think, I mean, we still think EVV for home health is ridiculous. I mean, it doesn't make sense, they're paid per visit.
Correct.
And, you
Yeah,
know, I
not
mean, I don't know what MAHC is gonna be looking at on home health EVV records.
I just
That's
said,
why
when,
it's,
I don't know.
that's why it's so hard.
It is, that's why
Because it's hard to
so
even
kind
know
of
what to look
comprehend.
for.
Yeah, but that would be my suggestion for
That's
home
it,
health
I like that
agencies.
idea a lot. So just to kind of wrap up what Carol was saying.
Thank you.
So say Abby's working for 3 different agencies, and one agency uses the last 4 of her social, one uses her first and last initial and the last 2 of her birthday, and another one uses some random system assigned number. There is no way for us to know, if we go in and look at that aggregated information, that all 4, or all 3 of those numbers are all the same admin. So we talked about all different ways of achieving the goal of getting everybody something consistent. People do not like to use their social security number. I do not blame them. We can't do that. So the least risky and the most probably highest probability of making that match, we decided was the Family Care Safety Registry number. Everybody has to go through that registry anyway. It's part of doing business here. So to Carol's point, when you bring on new staff or as you start going through the files of your current staff, find that number. Yeah, and write it down in their record. So that is readily available, or put it in a spreadsheet, whatever you wanna do. There is a link on our website that if you're not familiar with how to get the Family Care Safety Registry number, there's some information on there and it can tell you how to get that. But, that's a great idea because
Now I
a lot,
understand.
riders were caught off guard. Like, they're like,
Yeah.
well, because it wasn't a plan, it just kind of like, it came together. And some of them were like, we have 1,000 caregivers, so that's 1,000 records where you're going through. So, what?
I said the number wasn't hanging out in their AMR, it was in the paper record or the.
Right, so yeah, it was like the manual, look it up and figure it out. So get ahead of that game,
Gotcha.
because we will be requiring that Family Care Safety Registry number.
So that website is where we need to go to find out how we look up that number?
No, that's just totally random slide, we got off track.
Okay.
So I will tell you, and will they have, access to this PowerPoint?
Yes, they do.
And
Yeah,
did
it's
you,
online. Yes.
did you send it to,
Yes.
Jeannie?
Yes.
I think I get it. It's probably, okay, so this one's a little bit updated, but the last page is the same. On the last page of this presentation, there are links to all kinds of stuff. Yeah, we'll just talk about that for a second. So that first link there, that says State EVV webpage, everything that we have done with EVV is